Goni skill, shoulder flexion. Position the patient supine with the knees flexed to flatten the lumbar spine. Position the shoulder in 0 degrees of abduction, adduction, and rotation. Place the elbow in extension so that the tension in the long head of the triceps muscle does not limit the motion. Position the forearm in 0 degrees of supination and pronation so that the palm of the hand faces the body. Remember to test the unaffected limb first. In patient-appropriate language, ask the patient to flex the shoulder. Assess the thorax for extension of the spine and movement of the ribs. The weight of the trunk may assist stabilization. Flex the shoulder by lifting the humerus off the plinth, bringing the hand up over the patient's head. Maintain the extremity in neutral abduction and adduction during the motion. Stabilize the thorax to prevent extension of the spine. The end of shoulder complex range of motion occurs when resistance is felt and additional motion causes extension of the spine or motion of the ribs. Assess the infield of the joint. This is firm because of tension in the costoclavicular ligament and sternoclavicular joint capsule and ligaments, as well as the latissimus dorsi, sternocostal fibers of the pectoralis major and pectoralis minor, rhomboid major and minor muscles. You're now ready to measure the joint range of motion. Make sure you expose the bony landmarks you will be using. Align the axis of the goniometer over the lateral head of the greater tubercle. Recall the technique taught in lab to locate the greater tubercle. Align the stationary arm parallel to the mid-axillary line of the thorax. Align the movable arm with the lateral midline of the humerus. Depending on how much flexion and internal rotation occur, the lateral epicondyle of the humerus or the olecranon process may be helpful references. Ask the patient to perform flexion of the shoulder as done previously, maintaining the goniometer in alignment through the entire range of motion and observe for any extraneous movements of the trunk. Read the degrees of motion on the goniometer and then ask the patient to return the arm to the starting position. Remain at eye level of the goniometer when reading the measurement. Make a note of the amount of degrees measured. Measure twice. If the measurements are off by greater than 5 degrees, take a third measurement. Take the average of the measurements and document it in the patient's chart. If necessary, assist the patient back to the sitting position. Average range of motion according to the American Association of Orthopedic Surgeons, AAOS, is 180 degrees.